There is now, because of integrative medicine, because of so much more understanding about nutrition and exercise, because of so much understanding now about lifestyle changes and the effect of all those things on disease, we are finding more and more, because of the work of people such as Dr. Dean Ornish, there is so much work now that's going into the statistical verification that in many more cases than we ever knew before, not only does diet, nutrition, exercise, and lifestyle affect whether or not we develop disease, but actually we're learning how much those things have to do with even the possibility of reversing disease. You might have seen, it was all over the news just in the last couple of weeks, stents that have people put in their hearts. We now know that dietary changes and lifestyle changes are just as effective at treating that heart condition as is stents. So what I have in my whole health plan, and like I said, go to Marianne 2020 and read it. You go to a doctor, right? Now, let's talk about this. Big pharmaceutical companies, and by the way, I'm not anti-big pharma. I mean, when you think of all the extraordinary things that are done for people with cancer and people with illness and infectious diseases, this is not about anti-medicine. I'm not an anti-medicine person. I'm not an anti-science person in any way, shape, or form. But when you have a profit-based healthcare system, you do have to be careful. It is the role of government to protect the people, to make sure that the role of governmental agencies is, as Lincoln said, of by and for the people, not of by and for huge multinational corporate interests. So when it comes to the role of big pharmaceutical companies, do I think that health insurance companies and big pharmaceutical companies have way too much of a role in healthcare in the United States? Oh, you betcha. You betcha. There's no doubt about that. And so when you see something like Medicare for All, it definitely deals with the health insurance issue. It doesn't deal necessarily with the big pharmaceutical issue. So we have to do, for one thing, we have to roll back the way the United States has surrendered its ability to negotiate for lower drug prices with big pharmaceutical companies. But we have to even go deeper. Right now, because of all the money the big pharmaceutical companies pay to medical schools, our medical schools, the average medical school gives a much more pharmaceutically approached education to medical students than it does to educating medical students about the effects and the beneficent healing effects and health sickness prevention issues that have to do with dietary issues, nutrition, and exercise. Most doctors you talk to say that when they went to medical school, they had half a semester learning about nutrition. So this is what happens in my whole health plan. You go to the doctor, and the doctor gives you, tells you what your diagnosis is, and the doctor tells you his or her ideas about what medicine you should take or what surgery you should have. Anytime there is a prescription of a pharmaceutical or a surgical option, it is mandated, as per my health plan, that you are shown, and probably be on the internet, that there is actually a register. So on this register, it shows for different diseases where here's the surgical option, here's the pharmaceutical option, but here is the lifestyle change recommended, here is the dietary change that's recommended, and statistically, in some cases, you can actually see what are the statistical differences in terms of ameliorating this disease and in terms even of resisting it. And some of these things are very, very amazing. And guess what? According to my plan, insurance has to pay for either one.